Welcome back to Sports Medicine on Tap. My name is Brandon Align. I'm sitting at Neck of the Woods Brewing Company with my good friend Dr. Frey. Dr. Frey, we're back.
I think you're taller.
Something's different.
I know.
My goodness.
It's been a while.
It's been quite some time. I think on our last episode, we released it on February 6th, right before the Super Bowl.
Man.
So a lot has happened between now and then.
Yeah.
And we've got injuries,
people getting healed.
All the good topics that we had lined up that we can't talk about now just because they're kind of out of date and all these other different things.
Yeah.
But a little bit of just life came at us pretty quick, and just a lot of things happened in the last 6-7 weeks or so.
Yeah. Each one of us would have something like, next weekend.
And then we did have a show lined up for a month ago, and then my family got hit with a stomach bug, and I was out of commission.
We'll get Dr. Webner on here again.
Yeah.
Like he was going to be our guest. And we'll get,
we gotta reconvene with Dr. Webner and get him on here.
And I went to Korea, man.
Yeah, you went across
Seoul.
Overseas.
Yeah, interesting trip. Really went for fun. Having a good time out there. Huge city. Had no idea what a big city it is. It would be the second biggest city if it was here in the U.S. and it's super tall city.
Yeah.
And a little bit like Spain in that, you get there at 9 in the morning. There's not a whole lot going on. Not a lot of people out in the streets. Not a lot open. 11 o'clock, things start opening up. 3 to 5. There's a break. You gotta take it easy. Yeah. Their version of a siesta. And go out at midnight, people everywhere.
It's crazy.
I know.
It's crazy just how when you go different places, different countries, and just like you said, even mentioned like the little siesta time of that's a very big European thing where just in the middle of the day, everyone kind of calms down a little bit. And just
food was amazing.
Yeah.
People are super nice. Great trip.
And you said you went with your family and all that stuff, right? Or?
No, so my brother-in-law turned 50, and he wanted to go to Seoul. And so, like, a few of his friends, we all went out there, and it was a good trip.
Yeah, it's funny. I think I didn't know at the time you were out there, and I texted you about. So I was like, "Hey, we're not doing a show this week. I have this topic." He's like, "No, I'm in Korea." I was like, "All right, yeah, definitely. We're definitely not."
It's a long shot.
Yeah, long shot to get that underway.
Yeah.
But yeah, I just got back myself from Florida with our baseball team to spring break.
Spring training.
It's always a good time. It's one of my favorite times to travel with. It's just you can't beat it. You leave here, it's cold, it's wet, it's gross. You go down the.
Where are they? Where do you guys set up?
We stayed in Kissimmee. Our rental houses were in what's called Champions Gate down there. It's about 30 to 45 minutes from Disney in Orlando and all that stuff. We had 9 baseball games in 9 days.
Yeah.
1 doubleheader, 1 day off. So the team went 8-1. So you can't complain.
Not a bad start.
I mean. The only downfall was we lost the last one, so it kind of was a bitter end of the trip, which kind of stinks. But other than that, you can't beat it. You go down. Every day was beautiful. The one day we had bad weather, we readjusted the game and missed a storm.
Yeah.
And then the one day we had a doubleheader was the coolest day down there, which was nice because the big thing when you go on these trips is like the acclimatization period is very minimum for our athletes. You know what I mean? Our student athletes they go down there.
Sure.
And we play. Most of the games are in these turf complexes, so the turf is just super hot. It's 85 degrees. Everyone's just dying of heat.
Right.
And I'm trying to keep everyone cooled a little bit, bringing ice towels and all that stuff.
Yeah.
But to get a doubleheader on turf on a day that was like 65 and sunny all day, it was just like the ideal situation.
That's nice.
We got in, got out, won the 2 games, and went home, and it was like minimum stuff happens, which was always good.
And that 85 feels a heck of a lot more when you're coming from 35-degree weather,
yeah.
right? Like and this is it. Like sometimes you get a couple nice days, you're 50, 55, maybe 60.
Right.
But really, for the most part, it's still a little bit chilly. And we're about to turn now. So, April tends to be a little bit, like you were saying, a little wet.
Yeah.
Chilly. It's not great, but which is what we're heading into. But
right.
Very soon.
But it was
the
nice.
Niceness comes.
Everybody, it's always a good thing to see our guys, go out there and be able to perform in just more comfortable weather. They're outside. They're not practicing. A lot of our guys, we come here to Total Turf all the time to practice because we have no indoor facility to do so.
Yeah.
So to get all the guys outside, to get on the baseball field and actually do what they love doing is always fun to see. And everybody feels better because you're getting sunshine all day long. You're outside.
It's great.
And you just can't beat it.
That's that's a phenomenal feeling. Go down there and just kind of soak it up for a little while. Yeah. And speaking of soaking it up, and speaking of baseball, man.
Yeah.
2 days away. We record on Tuesday nights.
Yep.
2 days away.
Yep.
Oh.
So when this comes out, we'll be a day after opening day.
Yeah.
Have a lot of games going on.
Yeah.
And that's kind of what we decided to go with tonight because, like we mentioned, we missed a couple injuries, some big things that, luckily enough, we missed out on doing another episode about Joel Embiid. in that time that we were gone. But we decided to go. Yeah, decided to go with a little bit of a opening day, Major League Baseball season preview, if you will.
Sure.
And
We wanted to do the NCAA.
Yeah, the tournament.
Tournament preview, but you were away. And then. But this is a good little opening day. It stinks a little bit because it would be nice to be able to get this out there.
Correct.
Before fantasy baseball drafts, and we're going to just miss that. But some good information here for people. Yeah.
Without a doubt, yeah. So a lot of different things to talk about. We found a good article with 10 big names, if you will, that kind of just went to different people coming back from different injuries. A good chunk of those, we're all talking baseball, are coming back from Tommy John of some sort with different timelines. So that'll be interesting.
Thank you, CBS Sports.
Yeah. Thank you, CBS Sports, for that great article and getting us squared away. So I guess we can just start kind of tack down the list, if you will. Start with someone we've talked about in the past. Back in episode 103, we talked about Ronald Acuna Jr. He tore his ACL back in last May and had surgery on June 4th of 2024. He's on his way to come back. I think he was in a report about a month or two ago around Valentine's Day, sometime in February, said he felt he was about 95%.
Yeah.
So you figure he's almost 10 months now, give or take, which is definitely past the usual clearance point of it's give or take about 9 months now, especially.
Right. But this is his second one, 2 years, but the other knee.
Correct. So he had the one, and then he came back for the year, and then he tore the opposite
He missed out on the Energy Lab program.
Yeah. Right? Yeah. I think we're going to touch on the Braves a little bit, too, because they have some more people coming back from injury as well.
Scary NL East.
Yeah.
Oh, man.
And, I feel like, in a sense, the Braves just kind of rode off in the shadows of last year.
They're not gone.
They're not going to be gone now. They're back. They're healthy. And I think it's the speculation at the beginning of any seasons that they come back with a full healthy roster.
Yeah.
And you just hopefully, if you're
hopefully you hurt them again.
Yeah. No, you just hopefully that roster stays the same to see what their capacity and potential really is.
Yeah.
Whereas last year when they started losing pieces like Acuna, and we'll mention later Spencer Strider's on the list of Tommy John guys, they just lose their potential because their starter guys or their aces and all that stuff go out of the picture. Then
if your top player goes down on both sides, then it's just hard to maintain, and then there's trickle down effect to everybody else. Yeah, for sure. But so Acuna goes down. I would say the only plus for him is that it happened early last year, right? So he's had a fair amount of recovery, and I have to say, a little bit nervous. The fact that it's kind of 10 months in, and he's not even. I think they're bringing him along slowly. He's playing, but he's not going to be on the opening day roster. They're talking about later April, I think, to bring him back.
Which makes sense. It's been. You don't want to see this guy go down for a third ACL surgery in 2-3 years.
True.
Then that's just now you don't want to get in the same boat as someone like Joel Embiid who's always getting surgery on his knees, and we're going down that path.
Over. Yeah. And then also, additional factor for baseball, I think, is it's timing, baseball timing, right? And that's just how that sport goes. Now batters seem to catch up with a little more quickly than pitchers. It takes a little longer for pitchers to stretch their arms out. Yeah. But even still, if you're really on reserve, if you're really going slow for 9 months, and there are a few other factors that go into that decision-making process. It's not just 9 months go back, but there's Cybex testing or what we call isokinetic testing. There's functional testing, and you really want to make sure that your surgical leg is 90% of your non-surgical leg. A little more challenging when they're both surgical legs, right? But nonetheless, you want to get up to 90%. You want to you want to handle the functional testing well.
Right.
And if you do, then slow return. But just like you said, he's still one of maybe if he wasn't injured, maybe the best player in baseball.
Right. He's up there. He's one of the elites. You know what I mean?
Yeah.
Without a doubt, he's not just a regular average Joe, if you will.
Take your time with that guy.
Right. And I think also too is that the fact, like we mentioned, that he has both sides now have an ACL repair.
Yeah.
Is that you don't want the quote unquote strong side that was already repaired once. Who's to say that there isn't some kind of movement pattern that's a little off because of that that happened that wasn't completely corrected the first time, and now you don't want that to become his normal to put him at risk for more injury or whatever. So
the next one,
you really got to make sure kinematically and that these guys are moving properly.
Yeah.
That, like you said, it's not just 9 months. Okay, see you later.
Yeah.
No, you have to pass all these tests and things, but you also don't want to make sure that there's a really bad compensation pattern developing over time.
I do have to say, though, for me, watching it, from the outside, we don't have access to the medical charts. We don't really know what's going on. We're not talking about his specific injury in general. We're just talking about ACLs in general. But for me, knowing what I know about ACLs and whatnot, knowing 10 months on a guy like this who has every resource available to him, it is a little worrisome. I hope that it's not a sign. I hope it's just cautious. And it's not a sign that it's not going quite as well as we had hoped,
Yeah,
and speed is a big part of his game.
Right.
Like
Steals bases. He does the whole thing. I mean, that's how he tore his ACL. He was stealing a base.
Yeah.
And he just came up kind of awkwardly, and the next thing you know, it was torn.
I didn't realize. Oh, God.
Yeah. So on top of that, it kind of just brought to my idea, too, is that there's going to be or could be a psychological factor with that, too, because he has been known for stealing bases.
Right.
So the first couple steals, it might be in the back of his head, like, oh, don't step weird, don't step weird, don't step weird. Okay, I made it to the base, I'm okay. It could just be something that he has to work through as well. But again, like you said, you don't have to get hot in baseball till later in the season.
It's true.
How you do in early April and May it'll definitely set you up for success or not down the line.
Right.
But you need your team to get hot when it matters, and you want to be able to play in September, October, and at the end of August and all that stuff. You want to excel.
Maybe
then.
into early November.
Yeah. Right.
Now I will say this again, counterpoint kind of a thing.
Mm-hmm.
If I remember correctly, he came back on the early side with the other knee, and so again, a little bit surprising if he's coming back on the later side.
Yeah.
With this knee, we'll see. My gut, if I had to predict. Actually, I'm kind of curious. What's your prediction for him for this season?
I think he has a late spark. I think it's going to take some time to get his timing down, everything else. And I think, again, we don't know, like we said, we don't know much about him other than what reports tell us. But I think there could be a psychological factor that he has to kind of get out of that rut and just
hard.
I don't know. It's going to take maybe 10 stolen bags to kind of get wash it and then kind of keep going.
Yeah.
Or it might take a while. Or hopefully it doesn't become this big sports psychology performance issue or performance anxiety, and he has a problem and he can't steal bases anymore. You never know.
My suspicion is fairly similar. I would say cautious optimism. I'm a little nervous that there's more to the story we don't know about. Assuming there is not, I'm guessing. Mid-season, he's firing all cylinders and becoming the Acuna we're used to.
Yeah, the batting average goes up, the on-base percentage starts to go up.
Right.
Starts stealing a couple bases. He's playing more back-to-back games. And that's another thing too.
Yeah.
How they manage his time on the field. They may start him a couple games, give him a couple days off.
A very good point.
Load management isn't just a topic in basketball, although it's predominantly talked about in basketball.
Right.
They also do it in baseball as well, especially getting guys out of the field and doing other things like that.
Yeah.
So I think in that regard, we'll see what happens.
Not a hard science, more gestalt at this point, but it's becoming part of the the general I don't know, approach.
Correct.
All right. So who's next up on the list?
Do we tackle? You just want to go right for the Tommy John crew, if you will?
All 12 of them.
Yeah, we got a list about 6 different names from
all
across the league. In different timelines of, Tommy John surgery. So Sandy.
Slightly different varieties of it, too, right?
Right. Sandy Alcantara from Miami, he had surgery back in October 23, which cost him all of last year.
Yeah. Man, was he good the year before.
Right. So that's someone that, has a whole year off. And that's kind of what you want to see. You don't want to see somebody down the line of we'll jump the list, if you will, down the Spencer Strider, who had surgery in April 2024.
Yeah.
We're not even a year out yet, and he's pitching again and doing other things.
Right.
But, Sandy Alcantara from Miami, Felix Bautista from Baltimore, they both had surgery on their UCLs and Tommy John October 2023. So, in theory, that's plenty of time.
Yeah.
That's over a year.
Yeah.
And that's kind of what you want to see.
Yeah.
I don't like seeing those Tommy John surgeries come, although I know with the internal bracing and the hybrid procedures now, if you will.
Internal brace and the reconstruction at the same time.
Everybody's coming in hot and coming in faster. And it's sure, you can. The timeline sounds better, but are you putting yourself at risk for more stuff down the line, or is it too much too soon?
Yeah.
But these guys who have over a year, give or take almost a year and a half at this point.
Yeah.
I think they'll be better off, and you'll see them have minimum issues, and
sure,
hopefully, knock on wood, if you will,
Yeah.
No recurrent surgeries or re-tears or nothing like that.
Yeah, a little nod to Arthrex. An internal brace is like a kind of this thick suture that we put in to augment or to sort of help support some of the ligament repairs that we do, and we see it across the board in so many of our sports medicine surgeries at this point.
Yeah.
And one of those things it has sort of changed, the way we treat these injuries and the way we rehab these injuries. And I think traditional thinking is that this is usually a 6 to 9 month recovery, like usually
Right.
9 months, maybe even longer.
Right.
And that now we've shortened the timeline. Not every single time, but sometimes 6 months, and you throw the internal brace in there in addition to your ligament repair, and the hope is one that is a higher rate of success. But then number two, possible return to play slightly sooner, maybe at 5 months.
Yeah.
Now with both of these guys, neither one of them is pushing that limit.
Right.
So that's in their best interest, right?
Correct.
Like that gives them the best chance of getting back. They were both filthy before. My prediction, my estimate is that they're going to be filthy again.
Yeah.
They're good pitchers.
Right. And I think the biggest thing that Tommy John surgery gives people the opportunity to is to take some time off and fix whatever movement pattern, pitching mechanics
for sure.
that they have this weird tweak in when they do this. Their hip rotates a weird way, or their shoulder dips in whatever the case is for.
We should have
pitching
had our
mechanics.
guy on the show.
I know.
Darn it.
But just giving them the time to fix all those things, fix the scapular stabilization and all
I
that.
apologize, Greg.
Like all that stuff gets time to get corrected and strengthened in the proper way, and it's like not like you're pitching all year round and you're having all these things, and you just give it some time to heal up and everything fixes itself, and that's the best part that I think comes out of these things. Obviously, fixing the UCL is the big issue. You need that, but
First and foremost. And the other thing we've talked about with this, right, is then people start to really, really focus on the specifics of strengthening in a way, like your forearm flexors and what, in a way that, like, they all do it. Like, they don't get to that level. They don't throw as hard as well as they can throw without actually paying attention to all this stuff. So they all do it. Yeah. But all of a sudden, like, they really, really drill down on some of the specific things that are injury prevention things, which sometimes also turn into, like, not just injury prevention, but like performance improvement, which is one of the philosophies of the Energy Lab, like doing these exercises that will hopefully reduce the amount of injury or the risk of injury, but also make you better at your sport at the same time. And I think that happens a lot because these guys are so focused on the recovery and the therapy.
And I think it gives them an opportunity to get more in tune with their bodies too. And I think they have a better understanding of so many different things.
Yeah.
I feel like a lot of those guys who come back that I've seen coming back from a UCL repair, they just know more about themselves because they just spent that 12 to 18 months focusing on every little piece of their world of pitching and correcting it and doing so that when they say, ooh, this feels a little more sore, this is like, now you became a kinesiologist over the time after your surgery, and you're telling us what's bothering you, and we had to figure out all these other things. But the timetable is always good for those corrections. But then to go,
speaking of corrections, multiple injuries.
Talking about Jacob deGrom, right, with his second UCL repair. He did return last year. That's right. I remember when I looked up this pre-show. He did return for a couple games, but then they just kind of
couldn't do it.
They just let him kind of ride out. Like, okay, you got a couple starts, good. We finished the season. You made your comeback now. This year they're kind of diming it or coining it as his comeback year because it's his first full season back.
Right.
And he's not going to be short. So I think
was it late in the season that he came back?
Yeah, like September. So he started a couple games in September.
Yeah. Okay.
So
yeah.
That makes sense.
What a talented pitcher, man.
Right.
Yeah, and to think that he wasn't a pitcher growing up,
which is nuts. Which is like one of those things where, like, is that why he's so good? Because he just kind of picked it up late and just had a good frame on him and like a good foundation and just made the pitch. Like, we have a guy on our team that didn't play baseball till later in life, and he's one of our best players.
Is that right?
Yeah, and it's just kid's a phenomenal athlete and just learned how to hit a baseball. And next thing you know, he's great.
I almost wonder, he's a really good athlete, right? He's a really good baseball player who also happens to have a really good arm. So when you put those two things together, i.e. Shohei, right? All of a sudden you have like that's like the best of both worlds. Yeah. Not just a random guy with a great arm, but a really good athlete with a great arm. And I don't know. Yeah.
No, and I think it's just one of those things we'll watch out, and I think he'll come back strong. He has plenty of time. He had a little stint last year. He ended the season throwing in some games. Then he had just more time in the offseason to get better, and he probably attacked it during spring training. Is probably going to be phenomenal this year.
I got to go cautious optimism.
Yeah.
Only because of his injury history. Like
Right.
like he has been made of glass. You know,
Right.
like one of the best pitchers of all time when he's pitching.
Right.
And then, but like there's just too many interruptions in the process.
Yeah.
And hopefully this time the elbow holds up. Hopefully he gets through his year. I think he'll be good when he's pitching again.
Yeah, I think-
and the question mark is, does he get through the year?
And I think one of the articles I was reading about him was like, he is one of the best pitchers on the mound, and he's elite when healthy.
Yeah.
If he's healthy.
If he's
like
healthy.
That's
Right.
his little asterisk next to his name of kind of like, you got to get through the injury
If he's
bug.
healthy, right. And he's so good even as a hitter. It's not Ohtani good, but like he's better than some pinch hitters.
Right.
Like he's
Yeah.
As a Met fan, remembering him through those years, like really fond memories of that guy.
Yeah.
Really, really good athlete, really good pitcher, good guy. Yeah.
And same thing with Spencer Strider, if I'm not mistaken. He also is on the double Tommy
Oh,
John surgery as well.
Oh, is it?
I think so. I think he.
My gosh, I didn't realize that.
I'm pretty sure.
The interesting about him is Tommy John surgery, came back, out again, completely new injury, other arm,
Yeah.
different spot. So
Yeah. So 5 years in between his Tommy John. Spencer Strider had Tommy John surgery while he was at Clemson in 2019.
Yeah.
And then in 2024, he had the internal brace procedure to address a UCL issue, not a full tear, per Google
So it's
AI.
partial tear, and they just internal brace it. They didn't put in a graft.
Right.
Oh, interesting.
So that does
Interesting.
make things a little more interesting, right? So it's not a complete tear. They didn't completely reconstruct it. They just kind of.
So to explain that, right? Like,
Yeah.
so you have a ligament in there, right? And the ligament in there is supposed to bear the brunt of the stress, bear the brunt of this force. It's a ligament that does not heal very well on its own. And you start getting some stretching or some tearing. It's really more of kind of a stretching scenario.
Right.
And with all the force these guys are putting through their elbow when they pitch, it doesn't hold up. So oftentimes, like I sort of joke around tongue in cheek when I have a patient with some elbow pain or whatnot on the medial side. I'm like, hey, good news is you don't throw a ball 95 miles an hour for a living, because you can do pretty much everything in life other than throw a ball 95 miles an hour.
Exactly.
And but when they start throwing a ball 95 miles an hour, that puts too much stress across that compromised ligament. So if it's fully torn, reconstruct the ligament, right? Repair doesn't work real well, so you just reconstruct the ligament. But if it's partially torn, there's this thought process you can get away with adding the internal brace, taking some of that stress off the ligament, and then get back a little bit sooner. So it sounds like that's what he had. And he did. He came back last year only for a couple games, only to... What, he landed on his other shoulder, and is that Spencer Strider?
No. You're talking.
I got the wrong guy.
Yep.
I'm sorry.
No. You're right in that he got surgery back in April 2024, so he's almost a year out from the internal bracing. But they just augmented the previous repair. So
Right.
So yeah, I think he should come back and do well, considering it's just kind of like a little patch job, if you will.
Yeah. Yeah. You're right. All right. And I hope so. I hope so. I think that he will. I hope that he does.
Yeah.
Sometimes it's better to just go all the way right from the beginning.
Yeah. That makes sense.
Do both.
Yeah.
Sometimes.
Right. Just get it all cleaned up and get it fixed.
Every now and again you get away with, and I hate to put it like that, get away with the smaller version. But sometimes, and I hope he does get away with it. But sometimes, but we'll see. We'll see how it shakes out.
Yeah. So I think you were alluding to the case of Shohei Ohtani.
That's what I was getting at.
Which is very complicated, if you will, in that he also had Tommy John surgery back in September of 2023.
We all remember that.
Didn't pitch at all last year.
Yeah.
But he was DHing throughout the year.
Yeah. Stud, 50-50 guy.
Yeah.
Come on.
Just unbelievable,
I mean,
right?
not even real.
Right. And it's just another thing of but then late in the playoffs, if I'm not mistaken, he dove into a base and dislocated his non-throwing shoulder.
That's what I'm talking about.
And that required labrum surgery after the season was over.
Yeah.
So now his return to play is and his rehab progression, I'm sure, is quite the file, if you will.
Right.
His file's got to be pretty thick on how you manage all that, because you want him out there throwing, you want him out there you want him out there hitting.
Yeah.
But then he doesn't have, his ability to hit a ball is going to be changed because now he has shoulder surgery.
Right.
Coming off the right elbow that he was able to hit with before, and he was even reported they slowed down his throwing rehab to focus on hitting.
Yeah.
Which is like, I guess from a PR standpoint, that's fine to say that you want to focus on that because of who he is and how much money he's worth.
Right.
But at the same time, it raises an eyebrow of like, well, is there an issue with that elbow that they're really taking cautious for? And they're just kind of...
I think it raises a big eyebrow.
Right.
Right? He was a year and a half
Right.
into his recovery on the elbow,
Mm-hmm.
and like 4 months
Yeah.
into the recovery on the shoulder.
And they're slowing him down a little
And you're going
bit
to slow down the elbow
for the shoulder to hit.
for the sake of the shoulder? Either the shoulder's doing phenomenally well, or they're protecting that elbow.
Yeah.
One or the other. It's a little bit suspicious. Maybe there's another nugget of logic that went into this thinking that I'm not factoring in.
Yeah.
Shoulders typically do better. Oftentimes labral tear. We talk 4 to 5 months until it's going to return to play and recovery. And granted, so with his labral tear, we're not worried about throwing. We're worried about hitting. So you can be a little more aggressive with it. But still, he was 4 months removed from his labral repair.
Right.
And a year and a half removed from his Tommy John surgery.
And
Why are you pivoting to
Right.
stress the shoulder?
And he bats left-handed, and he had surgery on his left shoulder, which is you're concerned of the backswing, but it wouldn't affect him.
He
on
bats lefty.
lefty.
Yeah, and it's his left shoulder.
Right.
Well, that's actually good for the elbow.
Right.
That's why he was able to play last
Right.
year. Right. Like the
Right.
Bryce Harper situation.
Right.
Yeah. But I have to say, that's raise an eyebrow.
Yeah,
That's
like,
exactly what that is.
It's definitely interesting because you're like, well, he should be able to keep throwing with his right up, regardless of
with his right arm.
But so
Give
as
him
of,
time to let the shoulders have a little more time to get back.
or if for whatever reason the velocity and torque of his body aggravated the shoulder for some reason, for some odd instance or whatever, something weird that we may not, we obviously won't see. We're not in those practice sessions and bullpens and whatnot.
To me, I remember the Shohei thing happening, and I remember thinking to myself, like when it first happened, like, is that his elbow? Is that his shoulder? Do you remember?
Yeah, when he was running around holding his jersey. Yeah.
Yeah, and then I was like, it must be elbow, and then it must be shoulder, and then I was like, well, it didn't look too bad,
right?
But
he got it through it. I think
he did gut through it. I give him
World
credit.
Series for it. But per the reports that we read, when this show comes out on a Friday, he's supposed to throw a bullpen session on Saturday.
Right.
So he's returning to the bullpen to do some work and some throwing progression.
Yeah.
So I think also with the interesting timeline of thing is I also think there's a bit of an incentive based off how much money he's worth. When you have that much money invested in somebody, you take as much time as you need so you don't ruin that investment early in the, what is it, I think a 10-year deal, whatever he signed. Right. You don't want to ruin his chances of ever coming back and being a good baseball player in the first 9 months.
Of course.
You know what I mean? That's not a good ROI.
Now, on the flip side of that, we just talked about it. Your throwing arm, your shoulder takes longer to stretch out for pitching. Now, it's not shoulder specifically, but it's throwing takes a little longer to get up to speed than hitting. With that in mind, you would think you would start throwing first, hitting second. Another reason to go in the reverse order of what they did, in addition to the fact he was only 4 months out from his shoulder injury. Yeah, I don't know. I'm sure there's something more to it.
There's
something more than we know.
And then I think also with that too.
And in the end, it's probably you're right. They just want to go slow. They just want to go slow.
And I think with same thing with that, but also per some of the reports we read, it's deemed a quote unquote complicated shoulder surgery to repair his labrum. So whatever that means.
Still, you're going first on the shoulder.
Right. So whatever exactly is happening with his rehab progression, I think you would hope from an outside looking in that they're just being extremely cautious with a very, very expensive piece of their team. Yeah. That they don't want to mess up for the longevity of that contract because that's just a big hole in your pocket if he's not producing.
That's a tiny bit ominous too, complicated.
Right.
Are we sure it was labrum and it wasn't something called a haggle, humeral avulsion of the glenohumeral ligament?
It could be, but they just said complicated labrum surgery. And again, per reporting, they'll keep that as...
Again, we don't have access to his actual medical charts. We're not sure exactly what they did. But that's a tiny bit worrisome too. The only big plus there is that his batting. And not throwing, albeit a baseball player, because he's throwing with his other arm.
Right.
And that's probably exactly the reason why. Pretty basic, right? Like he can handle the batting.
Mm-hmm.
It's the throwing that puts all the stress across the entire arm, and because the shoulder, that one, it's his left shoulder, right? When he's back, yeah.
I wonder too if
that's probably it.
if the shoulder surgery messed him up at all in his throwing progression, just because he had to take some time off and then kind of had to ramp back up again.
Yeah.
And then maybe just didn't ramp up as well as he thought he could, so he just took some time off to do a couple extra things with XYZ.
Yeah.
And then got back into it again. Something we'll keep an eye on.
I wonder if at some point they start load management. You know what I mean? Like you every other start in terms of pitching, or you know, like you're not going to be an everyday player. I wonder if at some point they do that, because he's just that valuable. He's just that good.
Yeah, maybe they took all last year off of pitching, but he did have a bullpen session. I think it was in one of the articles back in February, where he was touching over 90 miles an hour.
All right.
So he's throwing okay.
Yeah.
But, I think we'll see. And I think they said maybe early estimates. I think this Saturday is going to be the big tell. After his bullpen session, they're going to have a better idea on where he's at coming back to the mound.
Yeah.
But I think early reports were saying that May of 2025, you're going to see him back on the mound kind of deal, and kind of do it that way. So we'll see what happens with that, because he's a big-time name. He's the biggest name in baseball for the most part.
For people who play, fantasy baseball, rotisserie baseball, it's like cheating.
Yeah.
When he's good and he's healthy, you probably have the best hitter in the game and the best pitcher in the game, and one guy.
Yeah, one person. And you don't see that.
It's unbelievable.
I think it's also crazy is when they do. I've seen online the stat comparisons of him and Babe Ruth, how almost identical everything is with their batting and pitching percent, all that stuff. It's a once in a lifetime kind of talent. You don't see it very often.
No. Although no, I'm not. I don't want to diminish what he's been able to do whatsoever.
Right.
But I think there are people where I think before it was don't even think about it, right? Are you kidding me? It's impossible. Now that he's paved the way, Babe Ruth was 100 years ago.
Yeah.
Now that he's paved the way,
I think two-way players are coming back.
I think two-way. If you're that good, foster it. See what happens, right? Why not? Why squash it in a kid who's 12 years old and wants to try to do it? So we'll see.
And I think it's just one of those guys. I think you could put Shohei Ohtani up there for baseball as Steph Curry is for basketball, and changing the game generationally.
Yeah, that's true. Yeah.
Steph Curry changed the way the game's played, because everyone
actually changed the way the whole game is played.
100%.
Amazing.
He's got records that I think are going to be a long time to be touched and broken. I think he hit his 4,000th three-pointer, which is eons past everybody else. He's just going to be untouched for a while. We thought Ray Allen did it so great.
Yeah.
He didn't even do it that much in comparison.
Not even close, right? Yeah, amazing. Yeah.
To go to another big name of baseball, who's another generational talent and local guy.
Local guy, we love to say.
We love our local people, Mike Trout.
Yeah.
33 years old, coming off left knee meniscus repair that plagued his whole season. He had 2 surgeries on this meniscus last year.
Yeah.
Ended up missing the whole year.
I don't like it one bit.
And he's, one of the best in the game by far, up there, but in the same kind of conversation as we mentioned with DeGrom, is he's only that good when he's healthy, though.
Yeah.
He's been a topic of our episode, of a couple episodes. I know he had a back issue.
Yeah.
He had a fracture of the hook of the hamate.
Right.
And we talked about that, right? And so he's so good, but then he gets hit with these injuries, and now he's out again. He's just,
I joke around about DeGrom being made of glass, but Trout's not far behind.
He's up there.
He's not Joel Embiid kind of glass, but he's
a different kind of glass, if you will. But only played in 29 games last year.
Yeah.
So not much for the Angels.
So I referred to this a couple of times. When we did the show covering Embiid, one of the 200 shows covering Embiid last year, that when lateral meniscus tear and could this be the beginning of the end? When I hear the way it unfolded, which I was not aware of, with Mike Trout, pretty early in the season, torn medial meniscus, way better than torn lateral meniscus, right, which is what Embiid had, right? And they did the surgery. They did a trim out version of the surgery. There's 2 versions: meniscus repair, sewing it together. Meniscectomy, trimming the torn portion out. Do a meniscectomy, try to get him back. What do you play, a game or something? A few at bats. I think it was in the minors too. And then his knees is bothering him, swelling. Repeat MRI. They note a new tear.
Yeah.
Always tricky to figure that out, by the way.
Right.
Like, especially that soon after surgery. Is it edema from the first surgery? Is it post-surgical changes? Is the guys that are reading that MRI for him are adept, well versed at doing their best to make that distinction. But then he goes back into surgery like a week later, and now he's out for the season.
Yeah.
And this is August, right? Do they do a meniscus repair the second time around? Was it something that was missed? There's something called like a ramp lesion or a meniscal capsular tear that maybe that was missed. A little more of a significant injury.
Yeah.
Like if it was just a second meniscectomy, they went back in and trimmed it. If it was early August, theoretically the season's not over. Maybe because Mike Trout, the season's over. Like forget it. Don't worry about it. And then if they do a repair, he is young enough that it's not that outlandish or that crazy.
Right.
But it is worrisome that someone missed a whole season off of a medial meniscus tear meniscectomy.
Yeah.
And I'm scared about where that's going, what that's leading to.
And then I think, another person to watch is they're already starting, the baseball version of load management. They're taking him from center field, putting him in the right field.
Right.
Changing his position a little bit. So he shouldn't have as much wear and tear on his body.
Right.
And, I think also with these kind of athletes, the guys who are so good, they don't know 80%.
Right.
They know all gas, no brakes.
True.
And when they're going as hard as they can, as giving as much effort as they can. That's why they're the best of the best.
Right.
But it's a blessing and a curse, if you will, because they can't get out of their own way and they're just hurting themselves more and more.
Yeah.
And he can't get over this hump. But I think the gray area is that he's getting older. He's 33 years old now.
Right.
At the end of the season, he'll be 34, and he's going to be in the twilight of his career, not in his young prime like he was when he came in.
Even though that's how I think of him. Like,
Right.
Yeah.
He's still one of the best in the game, but it's also like that title is going to he's going to kind of fall off.
He's
that
on the
tier
wind
level.
down.
He's on the wind down, and all these young guys are going to start coming up, and they're going to be on the top of the pedestal, and he's going to be the Mike Trout that was and not that is.
Sorry.
Your new guys.
Yeah, I know. But I there's a little piece of me that worries with the exact same conversation. Now, granted, lateral meniscus versus medial meniscus, but it was the exact same conversation with Embiid. Once you start having a little bit of arthritis in addition to the meniscus tear, it's no longer nearly as predictable recovery-wise.
Yeah.
And is that what we're looking at? And is that why he wasn't able to get back? Maybe they didn't do a repair. Maybe they just did a second meniscectomy. But he's getting arthritic.
Yeah.
And if that's the case, this could be definitively the wind down and maybe the very beginning of the end.
Right, and it's something you don't want to see for someone of that caliber and a local talent. Like you always want to see the guys coming from out of our hometowns or in our area, South Jersey, doing well long term. But like you said, if that knee starts to swell up after games all the time, then he's going to need a couple days off.
And they talk, Cal Ripken, like the guy couldn't walk before the game, and then he's out there, doing his thing. So you can manage that for a while, but yeah, it's just ominous. It's worrisome.
Yeah. You don't want to see him go down, but it's a human sport. They're humans. Eventually, the ticker runs out, and
at some point
they have to hang him up, and they go about their business and do something else. And I'm sure he'll be around the game of baseball for a long time. He's not going anywhere. But his elite playing days are definitely getting more limited as time goes on.
Yeah,
but
tenuous. I'll say. There may be more ahead, but tenuous. Yeah,
correct.
Yeah. I hope he gets back to it, man, because he's a likable guy.
Yeah.
Yeah, and he's like such we have a five tool, really truly five tool. Right?
Yeah, like truly right.
Yeah.
So to go down our list a little bit more, we'll go to the Milwaukee Brewers and Christian Yelich. Had back surgery back in August of 2024. Had a microdiscectomy, and now he's looking to make his comeback after missing the remainder of last season. So that's about 7 months ago or so.
Yeah.
So now he's coming back, hopefully to look well and do well for them, and see what we got with that. So
to my good friend Matt, nothing to worry about here. Microdiscectomy, golden.
Right.
right. Of all the back
Easy peasy,
injuries,
right.
Of all the back issues you're gonna have and all the back problems you're gonna have, if you're gonna have surgery on your back, I think that's probably the one you want to have. Right.
Right.
It works very well. Presumably, when they did the surgery, he had pain going down his leg. Right?
Yeah.
And
he had chronic back issues, I think, is what it kind of.
That worries me a little bit. If it's chronic back issues, right? I don't remember if it was Greenleaf or Dr. Sanfilippo that we had on here, and kind of the old sort of orthopedic aspect. Like it's very difficult to fix pain above the belt. It's much easier to fix pain below the belt. So pain that radiates down your leg, you do the microdiscectomy, and you tend to do very well with it. But if it was a chronic back pain issue, that's a little harder to get rid of. That's a little harder to resolve. Typically, if they did a microdiscectomy, what happened is he had a disc herniation squirting up against his nerve. It would cause what we call a radiculopathy, pain going down his leg, and they pluck out the little squirted out disc, and it's like a miracle, right? Like they took the pressure right off the nerve. Some people the next day they're like, so much better. Some people it takes a little bit of time. That rubber band's been squished for a little while. It takes a little while to get for it to bounce back to its normal shape. But I would like to think, I hope, if we got a microdiscectomy, that it was the leg pain issue, and we call it a back issue, but it's really because it's coming from his back, but it's really more of a leg pain issue. In which case, if that was the scenario, I would expect him to do real well. Once he's had time to recover, which hopefully he has, I would expect him to be back out there and playing. And I'm not a spine surgeon. That's just my take on it.
No, and I would trust your judgment over mine, since I'm definitely not a spine surgeon and far from it. But I think it's just one of those things where we'll see what happens with him, and you don't want to see. And again, I just double checked his age too. He's just with Mike Trout, 33 years old, kind of on the tail end, if you will. But you don't want to have the guy with a bad back out there all the time and playing in the outfield and all those other things. So hopefully, like you said, it took the pressure off. Problem solved for the most part, and he's going to probably be on top of all his stuff, doing everything he's supposed to do, and should be able to have a successful year and hopefully stay healthy.
The reference of my good friend Matt was to Matt Clintack, who now works for the Brewers. That's
there you go. So that's most of what we have on here for our baseball preview, if you will. And like we mentioned, it is March. It is March Madness, and we wanted
a lot of healthy guys in March.
It's a nice thing because
it's good for them.
Last year, I believe we had our
stinks for us.
We don't have that great of topics to talk about in the March Madness brackets, because last year I think is when we had Kevin Briles and Brad here, and we had a good amount of guys to talk about. Big schools coming down.
Two great dudes.
Great guys to have with us, but as with everything, sometimes we get a little lucky pass, if you will, and we get a little bit of sprinkle in the NCAA tournament on the women's bracket this time, which is different, but also a very good, interesting topic to have. USC guard Juju Watkins went down last night with an ACL tear. And okay, you lose one player, not a big deal. But I just wanted to look up. So from that, it's funny. My buddy sent me this stuff all the time. Like, hey, did you hear about this? And it's like, actually, I did. And I was trying to go to bed, and this game was on, and whatever. So I looked up, and she was driving the lane. She kind of got bumped by a defender, and she just went off to the side. And when she planted her right leg, it just gave out. Like classic non-contact pivot. Tried to catch herself, went down, holding things. She was carried off the court, and she's almost a 24 points, 7 rebounds, 4 assists athlete, if you will, on the basketball court. And that's impressive. Right? And USC's number 1 ranked, they're number 1 seed in their bracket. And I thought it was interesting of just like, I don't know who's the favorite to win in the men's side or the women's side at this point. I'm not the biggest college basketball guy.
I love it, but I've been out of the loop. And my
honestly,
bracket shows it.
I hear you on that. But doing our preview in the past couple years has gotten me into college basketball. And this year we kind of missed the boat on that. So I didn't get the time to actually sit down and read some stuff.
You didn't get your primer.
I didn't get a good primer in. But I did look up the odds of who's favorited to win on the women's side. And USC was a 10-1 odds to win the whole thing. Juju Watkins go down. They're down to 22-1 odds. So that's impressive.
That's an impressive player.
So you could tell that she is definitely somebody who makes an impact for that team. But, they still blew out the team. I think they played Mississippi State last night, and she got injured in the first 5 minutes of the game, and they still won by over 30-some points.
What round are they in at this point?
I think they're in the second round. So there was a second-round game last night, so I now think they're on to, what's that, like Sweet 16 is what they're at now? But I think it's interesting in the fact that, something that's a very common thing in our world of, females tearing their ACL.
Way more common.
And,
depending on what you look at and depending on, level of sport and whatnot, I'd say 3 to 5%. Or 3 to 5 times, not 3 to 5%. 3 to 5 times more likely. You run out into a girls' soccer field, and there's way more ACL reconstruction scars than if you're on out to the men's soccer field. Like, it's way more common.
Yeah, and I think it's just the world we live in, unfortunately, and just how men's pro sports are covered, that just have more. We get these reports all the time. Like, you're not getting as much information as you would from the women's counterpart.
For sure.
But, I think it's a problem, and there's a lot of focus in many different worlds of sport to prevent female athlete ACL tears.
That's right. Yeah.
FIFA developed a specific warm-up that they push out to all the soccer teams.
Yeah.
We at Rowan, we have our women's soccer teams, and our women's teams do the FIFA warm-up.
Is that right? Yeah.
Yeah, we definitely push it pretty hard. And everywhere I've been a big proponent of, like, no, we should definitely be doing this FIFA warm-up for our female athletes to prevent this stuff, because there's a lot of different things that put them at a higher risk for it. That's just, you can't
anatomy.
Change. Yeah, anatomy is the biggest thing. You can't change how they're made. It's just how the difference between male and female. Yeah. Different cue angle from the hips to down to the the knee, just the angle of the way the hips are made.
Yeah.
And then you go on to the investigating mechanics and different things like that.
Right. Like, hormonal cycles brought into question.
Right. Yeah, I was like, just going fact checking, doing different things, and then that was one of them, like the ligamentous stiffness and strength
laxity.
changes during their menstrual cycles, and hormonal changes, which is crazy interesting, because it's like, what are you going to do? Sit them during certain times throughout their cycles just to protect them? But, like, it's hard to predict and all that other stuff. So
and then there's also like quad dominant versus hamstring dominant. The way that you land, the way that you bend, the way that you fly. Like, so there are a number of facts. Increased flexibility, which may potentially pay. There's a number of factors that factor into this. But
and I think something to appreciate the difference, if you will, is from a bystander just watching the tournament, men's and women's side, right?
Yeah.
Watch any men's game and simply watch replays on how they take their jump shots.
Right.
Watch the angle of their knees, right?
When they land
and they jump, go up. And then watch a women's game and do the same thing. They're going to show the same replays. It's a little different. There's going to be a little bit
collapse.
You're going to see a little bit more of a knee collapse in general.
Not
everybody, but there's going to be more. I remember covering, like, I used to do it all the time.
Biggest risk factor. That's what we try to correct. Yeah.
You watch, for when I was at most of the time for college basketball, it's the women's game followed by the men's game, or vice versa, depending on the day. So, being a bit of a nerd, I would just watch people jump for 2 hours at a time, right? And you just watch a whole women's team, 5-on-5, both teams. I don't know, a couple of the girls may have good mechanics, but a lot of them, they don't. They jump up and down. They have that little bit of knee collapse. Yeah. Then you don't see that as much on the men's side. Just again, anatomical
injury prevention programs. That's really what plyometric programs before the injury, not after.
Right,
before the injury. Yeah, and do your. You could do everything right, and it may still happen anyway, right? Like, but at least you hopefully reduce the likelihood, improve your chances of not having that injury. And you can bounce back from it, and we're pretty good at fixing them, but it's still devastating, life-altering. And
and then you don't want to, and it's unfortunate, and you don't never want to see it when, a female athlete has multiple, because then you're just like, then you're just talking, especially if you go one side then the other side, or 1-2 on the one side, or whatever the case is. And
any athlete, Acuna.
Right. And you don't want to see it, but again, just women being at a higher risk, you never want to see that continually to happen, because that change these women's career. And then, I think women's basketball as a whole is on a upswing for a profession.
Clearly, right? Like Caitlin Clark, Angel Reese last year. Really a very sort of dynamic. I don't want to showdown. Maybe that's the best way to say it. Very exciting. They brought that game to the WNBA. But women's basketball has continued to ride that momentum.
And then,
like my daughter said, like they're having a moment. Like, this is great.
Right. And they changed the game for women's basketball specifically, and I think women's sport as a whole. Right. But even
I would almost equate it to women's soccer way back when, after Brandy Chastain Brandy Chastain, right? They whipped off her jersey, flipping around, have ridden the wave, ridden the tide, and you're right.
And I think when the long names of Caitlin Clark, Angel Reese, and if I don't want to mess it up, Cameron Brink, I believe, went down with an ACL tear in the first couple of WNBA games.
Yeah.
And again, someone who's a stud in college, goes to the next level, and just like that.
Yeah.
Just another devastating injury you don't want to see, and you hope that she comes back just as well.
Right.
But it definitely something that's seen so much more often. It's just we unfortunately don't appreciate it because it's just underreported. We don't see the reports as much.
The number I threw out there for likelihood, 3 to 5 times more likely than a male to have that same injury. There are estimates of 8 times, depending on what you read. Like eight times, 8 female ACL tears to one man. There is a very, very clear distinction, a very much higher risk for females, and I think it comes to the forefront when someone of fairly high stature has this injury. Right? Like it's such a I don't want to say devastating, temporarily devastating injury, right? Because there's still a career ahead for her. But
she's only a sophomore in regards to Juju Watkins here.
Yeah.
So plenty of time to still play.
But it just does put that much more of an emphasis on injury prevention, right? Don't treat it before it happens. Right. You're much better off.
Yeah, I think it's just something that will be definitely a focus going forward. Just I assume USC basketball is doing injury prevention on top of it.
I have to imagine.
You would have to imagine all these top.
Just like you said, you guys, like you take the FIFA program and you're working it. You have to imagine a program like that is on top of it. Yeah.
So we'll see kind of what happens. It's been a whole show and we're a bit rusty, and I forgot to give a quick shout out to Virtual Orthopedics and Spine. They have you covered from runner's knee to dog walker's hip, yard work, back, and laptop wrist. They have a doc for that. So find the right specialist for you at virtual.org/ortho.
You know what else we forgot to shout out? May 17th.
May 17th, yes. We always mentioned, we are at Neck of the Woods, and they are doing their annual Sour Fest on May 17th. Right here at Total Turf. I believe it should be as usual in the parking lot in the back.
Yeah.
Usually a great time.
Yeah.
Usually has some of the best crazy flavored beer that you ever going to taste.
Yeah.
So we'll see what happens with that.
And along those lines, right? There's been a turnover in Neck of the Woods, and it's sort of coincided with some of it happened really actually right before. Right. We missed a little bit of time, and it's just sort of bad luck, bad timing that we happened to miss a few weeks afterwards. But congratulations to Mike, the other owners who took over for Neck of the Woods. I will have to say the beer is still fantastic.
The beer is still really
good.
Really,
really happy with it. I'm excited to see how it goes. Sourfest, May 17th. Frank, we miss you, buddy.
Yeah.
But to credit to these guys for coming in and saying, hey, we loved everything he was doing. We want to keep it the same.
We want to keep it the same.
Yeah.
Just some new snacks in here, some new merch.
Merch, yeah. Nice
Neck of the Woods is still the same.
Up front, yeah.
Brian's still behind the bar giving us all the best stuff.
Not
much has changed here, which is nice. They still allow us to come here and record our podcast, so
we appreciate that.
Right?
Nice guys, yeah, for sure. And a couple cold ones on them.
Yeah, it always helps, right? So I think we covered a bunch of stuff tonight.
We did, all over.
We went all over the place. We've been rambling for almost an hour now. We kind of got
everybody's
the rust
listening is either at work or asleep.
Yeah. So before we go ahead and close out our tab, we're just going to give a quick shout out to Neck of the Woods, like we mentioned, giving us the coldest beer. Virtual Orthopedics and Spine, having you covered from runner's knee to dog walker's hip. They have a doc for that. Yard work, back, or laptop wrist, they have a doc for that too. They have Virtual Orthopedics and Spine has over 120 providers, 20 PT and rehab facilities, and more than 25 surgical centers all across South Jersey. So find the right specialist for you at virtual.org/ortho. And lastly, our good friend Kyle, who's going to get an email from me tonight. With Timberville Productions.
What is this all about?
Like, these guys are done. Yeah. With Timberville Productions helping us get all this stuff out to all you folks. So we appreciate all our listeners and supporters. Sorry it took us so long to get a show back, but we should be on a more quasi-normal schedule going forward.
Right.
And it's great to be back, and I can't wait to keep doing this. So good seeing you again.
You as well, buddy.
All right. Till next time, folks.